Community mobilization is one other important factor of successful community-based participatory research. Community mobilization can be viewed in 6 different stages, and community mobilization involves efforts to work with the community partners and stakeholders, thus increasing the community's capacity for sustainable change. When looking at the 6 different processes, it's important to understand the community context by assessing community needs, and then also collaborative planning, developing a mission and vision, objectives and strategies, developing leadership and enhancing participation, and community action and intervention. Evaluating the community initiatives along with promoting and sustaining the initiatives are also important in the 6-stage process of community mobilization.
Thinking about Robeson County community and NC ACE, how were these things translated into practice?
Earlier in the podcast, Dr. Spence, I heard her mention the Edwards Community Readiness Model, and so I actually think that's a really great model to use, so I'm going to speak from that kind of a framework. I guess looking at Robeson County, I would say that when the project was first initiated, meaning like after the grant was awarded, I would say that the Robeson County community was pretty high up in the stages. You know, there's a total of 9 stages, and I guess this is just a rough estimate, not based on anything, but I would say that they're probably at a stage 6 or stage 7. Stage 6 is about initiation, which basically means that, you know, how aware was the community, and definitely the violence rates in Robeson County are so incredibly high that all of the community was very aware and really acknowledged that there was an issue or a problem that really should be addressed. So when talk began about the possibility of the project being initiated in Robeson County, there were so many people, like individuals and groups, that were just very excited and welcoming, which, to be honest, is kind of like a touchy or difficult thing, because a lot of times when you're looking at a community who has identified an issue, bringing someone kind of from the outside can be tricky, because obviously, as Dr. Spence just said, was, you know, understanding the culture and the unique needs of that community are really important. So I would say they got a really great start because they were incredibly welcoming to these, what you might call outsiders, these researchers at Chapel Hill. But again, it just came down to the fact that they were just very excited and saw something that they thought really could help the community, since they were very committed. So in general, this issue is regarded as being something that was important, and the community wanted to work together with the researchers and the project to really look and find things that would make the community a safer place for everyone to live. So, you know, like I said, they're probably somewhere between a stage 6 and a 7. Stage 7 is called stabilization, according to the Edwards Community Readiness Model. And basically what stabilization, this stage means, it means that the key people in the community, so basically the people with the power, whether that be formal or informal power, those folks, such as like stakeholders, policymakers, decision makers, even organizations that are already working towards these efforts already, well, in this stage, that's where you see these supports. So that's why I kind of say almost a 6 or 7. So to begin with, what NCACE did, which is part of the mobilization techniques, is they went ahead and they started to develop their coalitions and their advisory councils. So they actually, to start off with, they developed a violence advisory council and a violence prevention coalition. And, you know, as I referenced earlier, you know, one thing that's really difficult for the NCACE team was that during the beginning stages of the project, the only staff that were involved were really just the researchers who lived in Chapel Hill. Since Robeson County is such a small rural area, as we know, understanding the specific cultural needs of the community is so incredibly important when taking on a project of this magnitude. So I guess, again, thinking of 6 and 7, I think at this point we started to see a little bit of conflict start, although the coalition and the advisory councils were established and the team came in and met with them and looked for opinions. What happened was, in the end, I think that some of these community members almost felt like they were just put there so that the researchers could really say that they included them. Because really, in the end, I think some of the feedback that at least I heard working, you know, from being in the community, was that a lot of members just really felt like, I mean, specifically, they really said they were just asked to join just to make the researchers feel good about it, because in the end, they didn't feel like they really contributed something, or any of their thoughts or opinions were really reflected in the outcomes. So it kind of regressed, and I guess another part of this is that from that point, after the team did their meetings and made some decisions about what interventions to use, they then had to go ahead and decide and make some decisions about hiring staff. Since everyone was kind of in Chapel Hill, what happened was they needed to have some staff that were local and have a local office. So they established a local office in Lumberton, and they really began to have some discussions about what's more valuable at this point. Is it better to hire the staff that are from the community and I guess limit the choices as far as qualified staff, or hire qualified staff but really look at them from being outside the community? So I guess in the end the decision was made that it was really more important to hire locally and to really get the community involved, which was a really great decision on the part of the project. But what we ended up having happen was there was some conflict among team members, and ultimately we had several staff members actually leave the project. And as you know, when people have complaints, those complaints go very far versus a compliment. So some of these complaints scattered kind of throughout the county, and then basically who you had left was what would be considered outsiders. So you've got the outsiders and you've got the negative talk going on, so that really damaged where the community was. So I think at this point is when we really started, if you're using the Edwards Community Readiness Model, this is really where you saw a regression from kind of stage 6 or 7 and really regress several stages. And I guess a couple more things I want to point out is within the organization, the service delivery just really varied in quality. Again, talking about staff and whether you should hire locally and look at your qualifications, what happened was because the decision was made to hire locally, the experience base or knowledge base of the staff was a little bit less. There are a lot of interns that were undergraduate interns hired and to complete their internship, and then eventually hired to do some work at the project, and they were undergraduates from UNCP. And then also you had just staff that had less experience with youth serving organizations. But again, this type of concern, it was initially addressed, and when discussing these priorities, I think the ultimate idea or ultimate hope was that there'd be some really strong leadership that would be able to develop staff, provide training, and the support to staff. And of course, this is a way that you can build capacity in a community. So for many reasons, there are struggles in the area, and I think this largely contributes to the project not being maybe as successful as it could have been. Doesn't mean it wasn't successful, but I do think that it probably could have been a little bit more successful. Planning includes the development of the infrastructure, and as we know, one of the ways to really create some sustainability in regards to implementation of evidence-based practice and programs, it's really to get the community to buy in. So, this is an area that probably, when we look at all the research and all the projects around the country, when Dr. Spence and I are writing our textbook, and actually if you get a chance to look at it, you'll be able to see. But I think in this specific project, one thing that we would want to do if we did it again would be to really spend more time planning versus just reacting when issues arise. I think just in general would have really strengthened the infrastructure, and again, thus ending with more sustainability.
All right, thank you.